Hello, everyone. I'm sorry I couldn't be there in person to deliver this report, but I hope this will be helpful. And again, after this meeting and when I return, if you have any questions, please feel free to reach out to me. I'm happy to set up a one-on-one conversation and go into it in whatever detail you might like to go into. So we've been following a fair amount of legislation. Obviously, it's a new Congress, new administration. So a lot of things are going on, and certainly the focus has been on COVID and recovery and economic recovery, which falls right into pace with this first piece of legislation that we're following, the GIMS Act. The GIMS Act, the full title is Gym Mitigation and Survival Act of 2021. There's a House version and a Senate version. And as we all know, you have to have a version on each side. They're, again, identical, but you have to have one on each side. They pass them, then hopefully it goes to the president for signature and become law. There's a fair amount of sponsors already for this, about 111 or so as of this recording, about 111 Democrats and 22 Republicans. And the idea is it's a $30 billion fund that will provide grants up to $25 million to small businesses, small gyms that have been economically heavily impacted by COVID. And we sent earlier a letter in support of this legislation. And currently, and actually IHRSA, International Health Racquet Sports Club Association, has taken our letter around to show other industry or other partners that are supporting it. They also now have a letter that is being circulated, and I think Ryan has probably sent it to you, that CREP would like to sign on to, asking that this be included in the recovery legislation the Biden administration is putting together. The two original co-sponsors, Representative Quigley and Fitzpatrick, actually sent a letter to the Biden administration asking it to be included. But this letter that's being circulated around through IHRSA is asking for sign-on. So CREP is hoping to be able to sign on to that, as well as your individual organizations. And we think this is really critical and vital, and it provides a lot of visibility for our industry and our field. The next thing that we have been covering pretty much since the beginning of the organization is athletic training and physical therapy bills, practice acts around the country, predominantly in the states. And unlike previous years, the ones that have come about, I guess 10 or 12 of them this year, have been more so focused on the specific requirements for athletic trainers and their supervision by a physician. So as of right now, we haven't seen any, and we bring them up at each of our meetings, our board meetings, and talk about them, but we haven't seen any that are of concern to us. So that's obviously good news, but we continue to monitor them. There's some that in some ways could have potentially had some, but they've gone away or they've been indefinitely put on hold. So that's a very positive thing. The Personal Health Investment Act, is the FIT bill. Now, we've talked about this a fair amount of time. There's a fair amount of co-sponsors on the Republican side. It's one of those bills, oddly enough, that's more weighted, 8 Republicans, but the Republicans that are on are sort of big names. And there's 3 Democrats and 1 independent. But this bill is providing health club or the $1,000 to $2,000 depending to be used for health club membership equipment, youth and sport activities and memberships. So I think this one we are hoping to get across the finish line. We had a ton of co-sponsors in the last couple of Congresses, and a lot of people have heard of this. They know about it. A lot of members of Congress know about it. So we're hoping that this continues to gain momentum and ends up becoming legislation or positive legislation becoming law. The Freedom to Invest in Tomorrow's Workforce Act. This one's kind of a broader reach, but it's very interesting nonetheless. This would allow the 529 plan, college 529 plans money to go toward certain things like tuition, fees, books, equipment, all required for credentialing, including examination. And these are for organizations that currently in the legislation that are the NCCA or ANSI accredited organizations. 5 Democrat co-sponsors and 1 Republican. But this is going to get widespread support by the entire association and credentialing field, because this is a big step to allow for that to be included and to be used in the 529 plan. Promoting Physical Activity for Americans Act. This is for HHS to promote physical activity recommendations no less than every 10 years, and 5 years at the midway point of this. So again, another very important piece. A lot of times these pieces of legislation, these studies and acts and all this information gets done, gets put on the shelf, and then collects dust. So a lot of things that we are trying to do in other organizations as well is making sure that these types of things actually get, when we're promoting physical activity, the importance of it, certainly after COVID, that we actually get it out there and get the visibility of it. You know, we talk about this. I was actually talking about this the other day with a member of the administration. They said, you know, what else can we do to help? Talking about some of these things. And I said, well, you know, you don't see any companies, and the government's sort of a big company, right? You don't see any company just put one advertisement out for their product and then go away. They do it over and over and over again. So I requested that they would actually help us in promoting these types of things and putting more information out about it besides just one or two times when it initially is released, because we should be working on it as partners. So they took that very well, and we're going to have further conversation with them about that. But I think that's critically important. So we sent a letter in support of this Promoting Physical Activity for Americans Act a little bit ago. And one of the people, obviously we're headquartered, and CREP is headquartered in Kansas. So Senator Moran is one of the people that we sent a letter to. And Senator Moran is also, along with Senator Duckworth from Wisconsin, the primary co-sponsors for the GENS Act in the Senate. So while we haven't seen him sign on to this yet, I'm hoping, I'll say it that way, that he will be supportive of it because he's supportive of the GENS Act as well. So the College Athletes Bill of Rights. This is a piece of legislation that was introduced. It's not current right now as of this recording, but it was introduced in the previous Congress. And the previous Congress ended obviously in December of 2020. But it was introduced in December of 2020, I believe, as a placeholder. Now, it's a relatively large bill, and there's another bill similar that's actually active right now that talks more about the likeness and use of the images of college athletes. But this one has a section in it that is of particular interest to us. About midway into it, there's a health, wellness, and safety standards of interest to what is, again, interest to us. And what it would do, it would establish health, wellness, and safety guidelines for intercollegiate athletic programs. So in it, they also are considering guidelines of nonprofit entities. Now, CREP has been working on some of these types of guidelines. So we believe that when this bill, when reintroduced, we'll be able to provide something and sort of get them off running with something that's already been established and put together that we have been working on. Senator Blumenthal was one of the main co-sponsors, as well as from Connecticut, as well as Senator Schatz from Hawaii. And I've been in contact with their offices, making sure that they let us know when they're going to reintroduce this, because they were very active in it in the first go-round. And they said yes. Now, of course, they're going to, these are contacts we have. They're going to let us know, but we're going to keep close to them to make sure they really do let us know. But they're very friendly with us. So we're hoping that they do. And then when they do, we'll try to provide that support and the information that we already have and the work we've already done in that particular space. Next thing is the Health Savings Act. It has some provisions in there, sort of in some ways similar to the FIT legislation. It allows Medicare deduction for exercise equipment, physical fitness programs, fitness facility memberships, and those types of things. Also nutritional and dietary supplements. So this one doesn't have a lot of co-sponsors right now. Senator Rubio and Scott, both Republicans, are the co-sponsors of it. But again, showing the interest in this particular space along with FIT, we don't mind seeing a lot of bills introduced because, again, it does show the level of focus and interest in this particular space. Now, the Physical Activity Alliance is an organization we work with that deals with a lot of these same activities and issues and legislation that we are involved in, and several members of CREP are also a part of that alliance. So we continue to work with them. That's a great opportunity for us to have information and information drops and hearing about and getting media visibility, because they do Hill briefings and media briefings as well. So us getting to be a part of that, again, raises the awareness of our profession and our field. We've also been involved in a subgroup of theirs about CPT codes, current procedural terminology codes, and how those reimbursements are done. Now, of particular interest, just yesterday, I had a great meeting with Dr. Keith Lee States, who is the CMO, Chief Medical Officer of HHS, so brand new into the Chief Medical Officer space with the new administration, and Carter Blakey. She is the Deputy Director of the Office of Disease Prevention and Health Promotion at HHS, Health and Human Services. But what's critical here is she's in charge of the physical activity guidelines. Those are the ones that recommend the types and amount of activity and physical activity in ways to improve health that we're looking at that for Americans. And it also coincides with Healthy People 2030. That's a initiative that comes out every 10 years to attain health, positive health outcomes, thriving lives, and well-being free of preventable disease, disability, injury, and premature death. It promotes healthy development, healthy behaviors, and well-being across all life stages. So with this particular thing, it's important that we have engaged with her and with him, Dr. States. And the good news is that they want to do some follow-ups with us as well, which is very positive. Carter Blakey, again, the one with physical activity guidelines, she had several questions deep into it about CREP and about the 180-plus thousand people we have on the registry, wanting to know how we could affect change in this particular space. We also have a new initiative about personalizing the physical activity guidelines. It's called Move Your Way. And she had just yesterday signed off on a Federal Register notice. Of course, it has to go to the Assistant Secretary and then the Secretary of HHS before it becomes released to the public. But she's hoping it goes out in mid-June. But this, again, the Federal Register is information that the federal government's doing that they want the public to know about. Now, when they do these types of things, they're asking for public engagement. They don't necessarily have the ability to go directly to the public to ask for or to reach out to individual organizations, but this is the way they reach out to the public and seek feedback. So anyway, so she signed off on this Federal Register notice where they're creating or hoping to create, if it releases, a partnership with Healthy People 2030. Now, I talked to her about this, about how we can engage, and of course, we would, with the board approval, the membership approval, we would create a partnership with her office, and again, that's the Office of Disease Prevention and Health Promotion, and then again, sort of become partners in this space, so our voice can be even heard louder, and we'll be in the know with a lot of these things, and we can talk to her more about CREP and the work that we're doing in the registry. So I think that's really, really important for those connections. And again, they want to keep talking to us. We spent over an hour, which is a large number. Usually get 15, 20 minutes, 30 at best, but we spent over an hour talking with both of them. Other thing of interest is with Dr. States, again, Chief Medical Officer. He was talking about his interest in RPMs, which, remote patient monitoring, the wearables. He has an interest in that space. He also said that the CPT codes are on his priority list. And we talked about multimodal, the importance of that, which obviously the work that CREP does and the members and those certified do in that particular space. And he wants to have that multimodal piece utilized in a more meaningful way. So he has had discussions with CMS about Center for Medicaid and Medicare Services, about CPTs. So I think we have an ally in that particular space as well. So all these things are very, very positive things, and we continue to monitor these activities, engage in these activities for the membership. I think we're making some very good progress, and again, with these meetings from yesterday, very, very positive in the direction. And so I'll stop there, but I would say, too, again, if you have any questions, please let me know. Please let Ryan know. I also think Ryan sent out some information about the Physical Activity Alliance, that they're having a sort of intel about what they do. I think it's on the 16th at 1 to 2 Eastern, I believe, but he sent the information out, I believe, so you can look into that if you're interested in learning more about it. But again, I will be happy to provide any information I can, go into any detail. We can have one-on-one calls, or I can provide whatever paper documents I have that I can share with you about any of this. So again, thank you for allowing me to offer my report in this particular fashion. It was an unavoidable conflict that I couldn't get out of, but I very much wish I could be there, but I hope this was very helpful to you. Thank you.